TACITO trial was a very interesting trial conducted by a few friends of mine in Rome, mainly in Rome, of fecal microbiota transplantation in order to try to boost the anti-tumor immune response in patients affected by kidney cancer receiving a combination of an immune checkpoint inhibitor and VEGFR TKI. The trial succeeded, showing more responses in patients treated with fecal microbiota transplantation. Unfortunately enough, the data are not mature enough to show the correlated microbiological insight that is needed in order to really understand what the authors have done in their patients. But it is clear to me that this is another piece of evidence supporting the idea that modifying microbiota could be a smart strategy in order to boost immunotherapy activity in several cancer types. Few questions remain unsolved. First of all, is fecal transplantation the ideal way to modify microbiota, or can we use bacterial supplementations, which is important because sometimes providing fecal transplantation is not easy from a very practical viewpoint. The second point is, if you use fecal microbiota transplantation, which is the ideal feces donor? Is it a patient responding to immunotherapy, as in the case of TACITO trials, or is an healthy donor like in other studies? So this has to be elucidated, as it is the role of the different bacterial strains, which we already know could really change the amount of activity of fecal microbiota transplantation.